So today we are going to cover the most important aspect of pharmacology, must-know session. We covered entire pharmacology in our face-to-face class, but today we are going to cover the most important thing, what are the must-know things before examination. To start, see, this year since COVID, we are all far away. Right. Are you really waiting for my slides? Right. This year, I think you all know the question number get decreased, so you may expecting a complicated question, mostly clinical oriented question. That too integrated question. They will integrate pharmacology with medicine, pediatrics, everything. So you need a very good approach. Not only pharmacology, you need a holistic approach towards your MCQ entrance examination. So you need good background clinical knowledge, integration technology, concept and smart thinking. Okay, right. With this, look here. They may ask this year only clinical based pharmacology question, mostly concept oriented question. For example, I start one question and then I go system by system. A patient with Alzheimer's disease needs treatment for overactive bladder. Which is the best drug choice for this patient? Like this question comes mean, you need some knowledge. What is problem in Alzheimer's disease? What are drugs useful for overactive bladder? Like that you should need an integrated approach. Okay. Alzheimer's disease, you know there is a deficiency of acetylcholine. Now look at the option. For treating overactive bladder, which is the best drug for this patient? Option given are darifenacin, solifenacin, talterodine, trospium. All these drugs are anticholinergic agent. We know anticholinergic agent causes urinary retention, so useful for overactive bladder. But when using anticholinergic in Alzheimer's patient having acetylcholine deficiency. So when you give anticholinergic agent, it will worsen Alzheimer's. So what is the best option? All are anticholinergic, but they should not worsen Alzheimer's vein. The drug should not crosses blood-brain barrier. So in this option, the best answer trospium, because trospium is a quaternary ammonium compound. That means lipid insoluble, does not cross blood-brain barrier. So this is very good answer, very good choice for this question. Like that, you need some basic understanding of subject. That model question will be coming. So I will rush my topic. What are all the things you should revise before going to your examination? We go system by system. In general pharmacology, I think if you have notes, please mark it. What are the things you should read repeatedly before examination? Everything is important, but some things must know. What are they? In GP, one very important question expected this year is something called P-glycoprotein inhibitor. We studied in our regular class the P-glycoprotein, where P stands for permeable pump, also called efflux pump. What are all the examples for P-glycoprotein inhibitor? Okay, so you should know example for P-glycoprotein inhibitor. Say, as Madam Diviti Madam told, I will give all my slides. I will upload you. The video will be available in your e-medical shop. So don't worry, doctor. You just mark down what are the things you should study before examination. For example, P-glycoprotein inhibitor, we have one thing called verapamil, amiodarone, cyclosporine, itraconazole, nifedipine, erythromycin. We may know the mnemonic vaccine Q. Like that we know vaccine Q. So one point you should know today, P-glycoprotein inhibitor. Okay, so don't worry, I will give all my slides. I will upload. It will be available in your e-medicos as madam mentioned, we'll give. So our aim is to support you. You please concentrate what are the must know topic in pharmacology. Okay, now the next point, very important topic, microsomal enzyme based questions are repeated question, so you must revise your notes. When I say microsomal enzyme, the most important microsomal enzyme CYP3A4. That is the enzyme involved in majority of drug metabolism. Like that, what are all the microsomal enzyme plays a major role? Important question. CYP2D6 involved in metabolism of codeine, beta blocker. CYP2C9 involved in metabolism of warfarin, phenytoin, losartan. CYP2C19 involved in omeprazole metabolism. This is very important must note point. That is omeprazole, a proton pump inhibitor, inhibiting CYP2C19 activity. So can you please answer, man? I want answer for you. When I say omeprazole is the CYP2C19 blocker, one very important clinical question, can you please answer? Which is the antiplatelet having interaction with clopidogrel? This is a question. Antiplatelet, a pro-drug which needs activation by CYP2C19. Who is that? That drug name is clopidogrel. So this type of interaction, omeprazole clopidogrel drug interaction, you must know. And another very important point, we have one thing called CYP2E1. This enzyme plays a major role in phase 1 metabolism of paracetamol. So paracetamol produces one metabolite called N-acetylbenzoquinoimidamine, that is by CYP2E1. So in a chronic alcoholic patient, this enzyme will get stimulated, thereby risk of more hepatotoxicity. That model clinical question important. So CYP2C, the CYP microenzyme is very important. Next important question you should know, the dose response curve based question. DRC, dose response curve, were very important. Please revise your notes. What do you mean by efficacy? What do you mean by potency? What happened to efficacy, potency in the presence of competitive and non-competitive antagonism? For example, imagine the dose response curve. The height of the curve is called efficacy. The dose at which the drug producing maximum efficacy is called ED50, effective dose 50. The effective dose 50 is called potency of the drug. So what happened to efficacy and potency? Very important question. In the presence of competitive antagonism, the DRs will be shifted to right, where efficacy remains same, potency get decreases. This is very important must know point. In the presence of competitive antagonism, DRC will be shifted parallel to our rights. The efficacy remains same, potency decreases. Same model question. What happened to DRC in the presence of non-competitive antagonism? Here the DRC will shift down. That means efficacy decreases, potency remains same. So question, efficacy decreases, potency remains same. This model question very important. So pharmacokinetic chapter mean, please go and revise the must know points of P-glycoprotein inhibitors, very important. In distribution chapter, absorption, volume of distribution important. In metabolism, microsomal enzyme is very important. In excretion, one important point, please revise yourself. What do you mean by first order kinetic of excretion? What do you mean by zero order kinetic? An example for drug undergoing zero kinetic. I think you know the mnemonic 0 watt power. 0 watt power. That means warfarin, alcohol, aspirin, one more thing, aspirin, tolbutamide, theophylline and phenytoin. So it's called kinetic. Coming to dynamic chapter, very important question is what do you mean by efficacy, potency and what happened DRC? That's all. And the last one more chapter, I will adjust my voice. Okay. One more thing in ADR. This again very important question. They may give some clinical history and then they ask about adverse reaction based question. Okay. So the commonly asked adverse effect, that too teratogenicity includes, they may ask misoprostol, very important. Misoprostol, a prostaglandin E1 analog, teratogen, causes Mobius syndrome. Mobius syndrome, where the baby born with the 6th and 7th cranial nerve defect. And one more thing, DES, diethyl stilbestrol. This may cause hypospadiasis. That means the urethral opening will be under the surface of penis. And then very important, lithium causes Epstein anomaly, that is tricuspid atresia. And very important, thioamide, that means anti-thyroid drugs, anti-thyroid like methimazole, carbimazole. The methimazole and carbimazole, they may cause aplastic cutis. And then thalidomide causing phocomelia. Like that you should know teratogenicity. So that finishes general pharmacology must know thing. Coming to ANS, next topic ANS. If we have your notes, please mark down, doctor. What are things must know topic? Mark. In ANS, most important thing you should know, what are all the important drugs acting on urinary bladder? This is very expected question, man. Okay, expected question. For example, M3 antagonist like oxybutynine, fluvoxate, tolterodine, fesoterodine. Beta 3 agonist like mirabegeron. These drugs are going to cause relaxation of detrusor, causing retention urine, thereby useful for overactive bladder. Okay. And another important group of drug acting on bladder is M3 agonist. For example, bethanicol. It is going to cause contraction of detrusor, causing urination, useful for treatment of post-op retention urine. And then we have one thing called very important must know SNRI, duloxetine. The duloxetine having causes constriction of urethra, thereby useful for stress incontinence, urinary stress incontinence. And then we have one thing called alpha 1 blocker like tamsulosin. It is useful for treatment of benign prostatic hypertrophy. They may give some question, a patient, elderly male patient with a problem like this. So all the thing converted to clinical aspects and ask question. And another important question, can you please answer? Name the drug of choice. Come on, name the drug of choice useful for treatment of nocturnal enuresis. Can you please answer, answer? I am looking your chat box. how far you are good in preparation. I want to check. Can you please answer? Name the drug which is called drug of choice for treatment of nocturnal enuresis. That's called desmopressin. Desmopressin, a synthetic V2 analog of vasopressin. V2 analog of vasopressin. Very important. Also, we can use imipramine. Imipramine, a tricyclic antidepressant having very high anticholinergic action. So that can also useful. So this important question, this recently asked AIMS question actor. So please remember, it can be repeated in NEET also. That is how to approach a case of nocturnal enuresis. Please refer your medicine notes. How to approach a nocturnal enuresis. It's an important question. And then another must know topic in ANS, very important, alpha to agonist topic. If we have a text, class notes, please mark down. Very important. Alpha to agonist based question, we can prepare plenty number of clinical questions. For example, look here. We have clonidine and methyl dopa, centrally acting antihypertensive. Based on that, so many questions can be prepared. For example, methyl dopa, as you all know, drug of choice for hypertension in pregnancy. Based on that, you have to revise your notes. What are all the safer antihypertensive in pregnancy and what are the unsafe antihypertensive in pregnancy? This part you should revise from medicine and from my notes also. And then look here, moxonidine, rilmanidine, these also centrally acting antihypertensive, but the advantage, less risk of rebound hypertension. Less risk of rebound hypertension on withdrawal. And then guanafacin, guanabens, they useful for treatment of ADHD and tics. And then very important, apraclonidine, brimonidine, alpha agonist useful for treatment of glaucoma. This you should know very importantly. Once again, alpha to agonist may cause drowsiness, so unsafe in children. And apraclonidine as a eye drop, locally it may cause one thing called lid lag. Brimonidine causes uveitis. All this you must revise, And tizanidine, important centrally acting SMR. And finally, dexmedetomidine. It is a Gibber question. So this can be repeated in NEET also. Dexmedetomidine useful for pre-anesthetic medication and for sedation. Now, my dear friends, one tough question I want to ask. The tough question, can you please answer? Name one alpha agonist useful for treatment of withdrawal symptom of opioid. Useful for treating withdrawal symptom of morphine or opioid. Name the alpha agonist recently approved for treatment of opioid withdrawal syndrome. That drug is called lofexidine. Very important. So a lofexidine, a alpha 2 agonist approved for treatment of opioid withdrawal symptom. This you must revise. And another very important area regarding beta blocker, you must know. Okay, beta blocker means we have cardio selective beta 1 blocker and we have non-selective beta 1 and beta 2 blocker. But the must know topic will be very important is third generation beta blocker. Somebody answered very nicely. Santosh and Harshada are nicely answering. Good. Your preparation was too excellent. So please go ahead. Very good. Right. Now look at the third generation beta blocker. Very important. You revise yourself. Third generation means beta blocker having additional property. If they have additional property, they call third generation. For example, beta blocker having additionally alpha blocking property mean think of labetalol, carvedilol. Very important. Labetalol, a very fantastic drug of choice for hypertension emergency in pregnancy. So it's a clinical question. Hypertension, emergency, pregnancy, they may frame a question. For that, the best drug of choice, labetalol. And then carvedilol, it's a beta plus alpha blocker having so many extra action. For example, it has anti-inflammatory action, antioxidant action, calcium blocking property, approved for treatment of heart failure and hypertension. Here you must revise what are all the beta blocker useful for treatment of heart failure. That includes carvedilol, first point. The other beta blocker approved for treating CCF includes we having bisoprolol, metoprolol, and also we have one more thing, nebivolol. All these are beta blocker approved for treatment of CCF. Okay, and then other thing you please revise, that is beta blocker having additional alpha blocking property, we extra drugs also, and beta blocker having nitric oxide releasing action, that is vasodilatory property, includes lot of drug like nebivolol, nipradilol, bobindolol, celiprolol, cortiolol, and beta blocker having potential opening action, tilizolol, beta blocker with the potential blocker, sotalol. Very important. Sotalol, actually beta blockers are comes under class 2 anti-arrhythmic agent, but sotalol classified under class 3 anti-arrhythmic agent because it has beta blocking property. And then beta blocker having calcium channel blocking properties are we having carvedilol and betaxolol. Like that, in ANS you should revise very important MCQs of example for anticholinergic agent, and then alpha blocker, beta blocker. Alpha beta blockers are very important, revise. And then look at this. Can you answer this question? One simple question. Come on. Imagine for treating HOCM and for treating akathisia means restlessness, and for treating performance anxiety. Anybody? For all these three cases, I have one common drug that is called drug of choice. Can you answer me? What is the drug of choice for these cases? It is propranolol, a beta blocker. So, purpose of drug of choice for this case. This type of clinical question, suppose they frame a question clinically, HOCM patient with a clinical symptom, or they may frame a clinical question based on extrapyramidal side effect, or they can frame a question based on anxiety. So, clinically we can frame question for this is drug of choice is propranolol. Like that question can be framed. Then coming to cardiovascular system and renal. Here what are all the must know drugs and must know point you should revise. That includes, look here. In cardiology, first chapter is angina. So they ask angina and clinical symptom, and then they ask question. For example, look at this question. I want to ask one question. Imagine this patient having angina pectoris. For treating angina, he was on some drugs. My question, name the anti-angular drug that causes aphthous ulcer. Look at this ulcer in the mouth. Which is the anti-angular drug causing aphthous ulcer? Nicorandil. Very fantastic. Okay. So the like that they frame the question. So you should keep on read what is nicorandil, and you should revise other important anti-angular agent also. Now look at this. My next question, look here. Can you answer me one clinical question? Imagine a patient is a Parkinson disorder patient. My question is, name the anti-angular agent that are going to aggravate the movement disorder, thereby not suitable for treating angina in Parkinson patient. Like that the question frame, patient having Parkinsonism, angina, they link together and they ask question. So nowadays they asking lengthy question, they expect a question, lengthy question. So for understanding question itself you need some time. So they may frame Parkinson patient with angina, which angina agent not good? Like that ask, your answer will be, we have one thing called trimetazidine. The trimetazidine is antioxidant. It's a pathway of fatty acid oxidation inhibitor. This worsens the movement disorder. And then they may ask clinical question based on ST elevation MI. This is important. So you should know what are all the important drugs useful for treatment of ST elevation MI. So revise. For example, painkiller like nitroglycerin, morphine. Here immediately your mind should think which are the opioid contraindicated for treating MI pain. That is important question. We have something called pethidine, pentazocine. These are all opioid contraindicated for treating MI pain because they cause tachycardia. So this point you should keep on revise. And then we have antiplatelet drugs, and then we go for recanalization either by thrombolysis or by doing angioplasty. One question, for non-ST elevation MI, don't do thrombolysis. This point you must know. Same treatment for this MI and this MI. Exception for non-ST MI, no role for thrombolysis. And then the must know topic, what are all the drugs useful for preparing drug-eluting coronary stent? That is important. The drug-eluting stents are prepared by using either sirolimus or by paclitaxel. So please revise this. Sirolimus is immunosuppressant, paclitaxel is anti-cancer drug. They are useful for preparing drug-eluting coronary stent. Once again you should revise. Even after doing angioplasty, the patient should be put on antiplatelet. That's important. Okay. Next, coming to second chapter, arrhythmia. Here your must know point will be different types of arrhythmia and their treatment you should know. For example, I want a simple question. Suppose a patient is having, answer me, suppose a patient is having supraventricular tachycardia. What will be the important drug? They make a history. Patient having this problem, having ECG like this, and diagnosis SVT like that. They frame lengthy question. After that, diagnose SVT. For SVT, the best drug of choice will be either we go for adenosine, or we go for verapamil. Like that, you should know. And then very important extra question, you both are given best option adenosine. Okay, and again very important, sometimes a VT or VF may cause cardiac arrest. Now question starts. Can you please answer, doctor? The question is, look here, cardiac arrest caused by VT or VF. For treating the VT, VF that leads to cardiac arrest will be what the choice? The choice of drug will be amiodarone. According to ACLS guidelines, Advanced Cardiac Life Support Guideline, remember, the drug of choice for treating cardiac arrest caused by VT or VF mean answer amiodarone. Very important. Okay, like that, different types of arrhythmia and treatment you should revise, that must know. Just read clinically, no one by one, just clinical point. And next point, they may put some ECG and asking you, come on, here tall T wave, tall and tenting T wave, maybe case of hyperkalemia. For treating this case, what is emergency treatment? Emergency purpose mean for rapid control of potassium, go for insulin plus glucose infusion. Other than insulin, what else can be useful for treating hyperkalemia? We have one thing called calcium gluconate can be given. And one more thing, beta-2 agonist. Beta-2 agonist also useful for treatment of hyperkalemia. Like that you should know. Emergency. Next. Amiodarone is very important anti-arrhythmic agent. So please read amiodarone detailedly. I have given full notes for amiodarone, mechanism action, uses, contraindication, adverse effect, everything. One of the problem of iodine, they cause blue discoloration of skin. It is called blue man syndrome. Blue man syndrome. I think we discussed on the day that adverse effects are mnemonic. Please check PFT, LFT and TFT. Like that we discussed. So please go and refer your notes. Pulmonary, they cause photosensitivity, pigmentations of skin, corneal deposit, pulmonary fibrosis, hepatotoxicity, thyroid dysfunction. So please go and read. And then regarding diuretic, there may be some clinical question. Imagine, suppose a patient is having having cirrhosis of liver and having ascites. Now answer me, which is the diuretic very useful for treating ascites or alcoholic hepatitis induced cirrhosis? For this case, best is spironolactone. Whereas there are some diuretics that should not be used for this case. For example, carbonic anhydrase enzyme inhibitor like acetazolamide. They are unsafe because they causes ammonia accumulation causing hepatic encephalopathy. Very important, the contraindication. Okay, and then look at the next case scenario. They may give a patient presenting with acute breathlessness, having frothy secretion from the mouth. On examination, bilateral basal crepitations are there and S3 gallop is there. What is the diagnosis? Like that they give history and asking for treating acute pulmonary edema. My question, for rapid symptom relief, go for furosemide, a loop diuretic. Whereas the disease modifying diuretic in this case will be spironolactone. Whereas can you please answer one super question? Name the diuretic contraindicated in case of pulmonary edema. Anybody? Which is the diuretic contraindicated for treating pulmonary edema? The answer will be mannitol. Mannitol contraindicated for treatment of pulmonary edema. That's important. And then look here. They may ask this type of question. Stones and diuretics. See, loop diuretic causes calciuria that may precipitate stones, whereas thiazide causes calcium reabsorption. So the stones are treated by thiazides. Like that you should revise. Next, regarding heart failure, expect a question, must know question. You should know one thing called what do you mean by neseritide? Neseritide, a brine natriuretic peptide analog. One more must know question. We have a new drug called omecamtiv. Omecamtiv is a direct myosin activator. Another must know topic already came twice in FMG exam also, that's called neprilysin inhibitors. What are the selective neprilysin blocker? This you must know. Ecodotril and sacubitril both are in neprilysin called neutral endopeptidase enzyme inhibitors. Next, regarding anti-hypertension chapter, what is must know? We have lot of anti-hypertensive drug, but clinically they ask me selection of appropriate anti-hypertensive drug you should know. They may frame clinical questions. For example, I show one model. For example, a patient having hypertension, also having symptoms of diabetes. So for treating hypertension with diabetes, what is the best anti-hypertensive? Like that they frame question. Here the best answer will be go for AC inhibitor or ARB, or else go for CCB. The best drugs will be ACE inhibitor and ARB. Whereas remember, for hypertension with diabetes patient, better avoid what drugs? Avoid diuretic and beta blocker because they will worsen the diabetes. They will cause dysglycemia. So better avoid diuretic and this one beta blocker. Like that, there is clinical based selection of anti-hypertensive medicine. Now I show one more example. Hypertension with dyslipidemia. Hyperlipidemia. Here what is the best? The best is be ACE inhibitor or ARB or else alpha blocker. See, these drugs having favorable effect on lipid profile. Favorable effect on lipid profile. So they are very good choice. Whereas better avoid what drug? Avoid using diuretic and beta blocker. The diuretic and beta blocker having unfavorable effect on lipid profile. Unfavorable effect on lipid profile. So better avoid. So selection of anti-hypertensive, you must know topic. Next, another very important must know topic, hypertensive emergency. This is important. What are the drugs useful for hypertensive emergency? So please revise your notes on hypertensive emergency from medicine as well as from pharmacology point of view. Very important. Please remember. Okay. We have one thing called hydralazine, potassium opener, esmolol, a beta blocker, labetalol, a beta plus alpha blocker, nitroprusside, a nitrate category, nicardipine, clevidipine, the so-called dihydropyridine group of calcium channel blocker, nicardipine and clevidipine, and then phenol-dopam, a D1 agonist, phenol-dopam. All these are very important drugs useful for hypertension emergency. Remember simply Helen D, and one more thing, phenol-dopam. All these are drugs for hypertension emergency. This chapter you should revise. Whichever clinical topic, read well, man. That's the main thing. Okay. Next, can you look at this picture and tell the diagnosis? Look here. Here. Look at the kidney and look at the blood vessel. Here, what happened? There is a case of bilateral renal artery stenosis. Here, what drug is contraindicated? The mean ACE inhibitor and ARB, contraindicated. So they may link pharmacology with the radiology also. So they may give radiology picture and asking you. So everything important. Okay. So pharmacology mean medicine, pediatrics, gynecology, radiology, everything, physiology, everything you must correlate and answer. Okay. Next, very important, anticoagulant chapter you must revise here. Newer drug, orally given newer drug, injectable newer drug, very important. Please revise. For example, we know warfarin, a old drug. What are the newer oral anticoagulant? Where we have one thing called direct 2A blocker. For example, zymelangatran, dabigatran. Here, zymelangatran causes hepatotoxicity that was withdrawn from market. Whereas dabigatran available, but the dabigatran undergo renal route of excretion, so unsafe in kidney failure. Now I want to check your knowledge. Can you please answer? Any anticoagulant will cause side effect of bleeding. My question goes to all people. Please answer. Dabigatran, a orally given direct 2A blocker, that also causes bleeding. My question, what is the antidote? Can you please answer? What is the antidote for dabigatran? Expect a question. You must know question. The antidote for dabigatran, remember, we are having idarucizumab. Idarucizumab, very important. And then we have something called oral direct 10A blocker like apixaban, rivaroxaban, edoxaban, pictrixaban. All the drug name and all ending with XABAN, XABN. For this, we have one antidote that is called anti-xanate alpha. And finally, for 2A blocker and 10A blocker, for both we have one common antidote that is called siraparendac. Like that, never oral, never injectable anticoagulant name you should study, that is very important. Similarly, antiplatelet also, that means you should go and revise thromboxane A2 antagonist, then P2Y12 blocker like clopidogrel, then GP2B glycoprotein 2B 3A blocker like abciximab, and then we have one thing called PAR1 blocker, that is protease activator receptor blocker called Orapaxar, etopaxar. All these are very important. So antiplatelet, anticoagulant, never drug you must know. Okay. Next. Sometime they may make a tough question based on pulmonary hypertension. So please read this also. For treating pulmonary hypertension, what are drugs? For example, we have PD5 blocker like sildenafil, tadalafil, CCB like nifedipine, endothelin receptor blocker like bosentan, and then PGI2 like hypoprastinol, treprostinil, like that. One very important new question you should know, we have one thing called Celexipac. Celexipac is the PGI2 receptor stimulant. It's a prostacyclin receptor stimulant called Celexipac. Expect the question. And then we have one thing called direct guanylyl cyclase activator. Can you please answer, doctor? One super question. Who is going to answer? Name some nitric oxide independent direct guanylyl cyclase activator useful for treatment of pulmonary hypertension. The answer is riociguat, chinosiguat. Expect a question, must know point, please read. And then we have Fasudil. This question came already 3 to 4 times in Ames paper, so you must know. Rho kinase enzyme blocker like Fasudil also useful for treatment of pulmonary hypertension. And then must know points in CNS. Look here. In CNS, you must know opioid poisoning treatment, opioid de-addiction, you must know. For opioid de-addiction, you all know the drug of choice will be methadone. If not, next option buprenorphine. And when there is a withdrawal symptom, treat this by lofexarine or by giving clonidine. Once again, can you please write to your chat box comment after complete de-addiction to prevent relapse of opioid, what is the best option mean? Naltrexone. Next question. Look at this. Imagine this patient is a chronic alcoholic patient. This is also important. For alcoholic de-addiction, very important psychiatric question. So pharmacology, psychiatry linking. The most important drug useful for de-addiction alcohol is disulfiram. After de-addiction, to prevent relapse, we are using withdrawal symptom is there, go for benzodiazepine. And for prevention of relapses, we go for naltrexone. This point important. Naltrexone useful for preventing relapse of opioid, as well as naltrexone useful for prevention of relapse of alcoholic habit. This point very important. Please revise. Next. Chronic opioid therapy causing constipation. So for treating opioid induced constipation, we use some drug called albumin, naloxegol, methyl naltrexone, nalmefene. All these are peripheral opioid antagonists. They may give histamine, a patient having cancer, terminal stage cancer, having cancer pain, for which given opioid, developed constipation, like that the big history is there. And then they ask, what is the drug useful for treating opioid-induced constipation? Answers are albumin, naloxegol, methyl naltrexone, naldimetine, like that. And then important question, EPS, extra pyramidal symptom based question can be easily framed. For example, in psychiatry patient, we give D2 blocking antipsychotic. When you give D2 blocking antipsychotic, there is a risk of EPS. So what are all the drugs useful for treatment of EPS? Very important. For example, for tardive dyskinesia, very important expected question, new drug called valbenazine. Valbenazine is a VMAT blocker, vesicular monoamine transporter 2, VMAT2 blocker. And then for generally EPS, we go for centrally acting anticholinergic like trihexyphenidyl. And for akathisia, drug of choice propranolol, like that. Antipsychotic side effect EPS and treatment important. Next revision, epilepsy chapter you must know. In neurology, anti-epileptic topic you must study completely. What are all the sodium blocker? What are all the T type of calcium blocker? What are the NMDA blocker? What are all the AMP blocker? What are the miscellaneous drugs? So anti-epileptic you should thorough, very important. All are must know topic in anti-epileptic. And anti-epileptic clinical question, we have something called what are the anti-epileptic useful for prophylaxis of migraine? For example, we have valproate, topiramate, gabapentin. Anti-epileptic used as a mood stabilizer in case of bipolar. In bipolar disorder, we have something called mood stabilizer. That includes carbamazepine, valproate, lamotrigine. Once again, very important revision point. The lamotrigine useful for treatment of depressive phase of bipolar disorder, whereas these two drugs are useful for mania. Okay, and then some newer anti-epileptic name you should know. For example, we have one drug called stiripentol. Stiripentol is a GABA analog useful for treatment of severe myoclonic epilepsy of infancy. It is called Dravet syndrome. And then one more drug called rufinamide. Rufinamide newer drug, a sodium blocker useful for treatment of Lennox-Gastaut syndrome. And very important latest point you should know, we have one drug called retigabin. The retigabin a newer anti-epileptic drug that's a potassium opener, is also called isogabin. This drug causes blue color pigmentation on skin. Sometimes they cause retinal damage. So what is retigabin? See, one of the common mistake by the student, when I say what is retigabin, they think gabin means they think GABA. It is not GABA. It's a potassium channel opener. This point you must revise. So never and totally very important. Another very important point you should know. I think neurologists may told you different seizure and different treatment. So what are they give some clinical symptom. From the symptoms you diagnose whether partial seizure or simple partial or complex partial, that need clinical knowledge. Once you diagnose, go for treatment. For partial seizure, we use either lamotrigine or carbamazepine, but the best drug choice will be lamotrigine. Like this, no. And then, for example, status. For status epilepticus, best drug choice will be lorazepam. Lorazepam is the drug choice, first line choice. After stabilizing the patient with lorazepam, to prevent to control the epilepsy, we use some supportive. What are all the anti-epileptic useful for status? For example, phenytoin and fosphenytoin. Fos means prodrug. So prodrug of phenytoin. And then we use sodium valproate, phenobarbital and propofol midazolam. All these are anesthetic agent. We can paralyze the patient with the ventilator supports. Also useful for status epilepticus. Okay. So different epilepsy and different choice. I think neurologist may give notes, that is different type of epilepsy and different drug choice. For example, absent seizure mean drug choice ethosuximide, partial mean drug choice lamotrigine. Like the drug you should know. They will not ask drug choice. They will give the history. From the history, you should be able to find out the diagnosis and go for appropriate anti-epileptic agent. Okay? And then, one latest point for Parkinson patient, the one case called Parkinson disease psychosis called PDP. We would call PDP. PDP means Parkinson disease psychosis. For treating this, we have one drug called pimavanserin. Sometimes psychiatric question, they make a tough question from neurology. Pimavanserin useful for what? So useful for PDP, Parkinson disease psychosis. It's a 5-HT2A inverse agonist. Okay, useful for PDP. And then sometime in psychiatry, antidepressant topic very important. Read everything about SSRI. Read everything about TCA. Read everything about SNRI. Read everything about NDRI. This is very important topic. Please read. Sometimes they ask clinical question. How to manage a case of TCA poisoning? In TCA poisoning, they have cardiac arrhythmias, convulsion, altered mental status, metabolic acidosis. How to manage this? For treating acidosis, go for first bicarbonate. And for treating arrhythmia, give lignocaine or betlium. Here, one important must know point. For TCA poisoning, don't use class 1A drug. The class 1A drug having anticholinergic property. They will worsen TCA induced arrhythmia. This point you must know, And then for treating convulsion, give diazepam. Like that, treatment important. Once again, for treating this poisoning, there is no role for hemodialysis because TCAs are having large volume of distribution. That also you must remember. Okay? No role for dialysis. And once again, they ask clinical question. Can you please answer, doctor? I want to ask one clinical question. The question is okay. Suppose a patient having Alzheimer's disease. That patient having depression. Can you please answer? For treating depression in Alzheimer's, which is the best choice? Options are SSRI or TCA. Can you answer? What is the best one? Question is, patient having Alzheimer's, having depression. For treating depression in Alzheimer's, which is best? TCA or SSRI? Answer is SSRI. Don't use TCA because TCA having anticholinergic agent. They worsen Alzheimer's. So avoid TCA in Alzheimer's because they have anticholinergic. This minor concept and all very important for understanding the question because they're linking psychiatry with pharmacology. You need a good knowledge. It's a minor point but important point. Okay. Next point. Migraine. Another neurology question, very important question. Remember, for migraine, we know acute migraine means we go for triptans like smart triptan, 5-HT1B agonist, that you know. And for prophylaxis, lot of drugs are there, commonly propranolol. But the latest one you should know, we have something called calcitonin gene related protein antagonist like olcigiban, telcagiban. Compared to this, you must know point. That point is because of monoclonal antibody targeting against CGRP, they call erinumab, fremanezumab, galganezumab. All these are MAB targeting against CGRP. That's important. And then very important psychiatric question. A patient, that too a postpartum lady developed depression, mean how to go through this. For this we have one drug called brexanolone. Brexanolone, a neurosteroid, a GABA analog approved for treatment of postpartum depression, expected psychiatry and pharmacology question. Okay. And then some newer drug useful for treatment of insomnia like suvorexant. Suvorexant is a Rexan, that is Vorexin antagonist useful for insomnia. And then narcolepsy, look here, excessive sudden daytime sleepiness. For treating this, we are using one thing called modafinil. Other things are solriamfetol and pitolisant. The two newer drugs are solriamfetol, that's NDRI, norepinephrine dopamine reuptake blocker, and pitolisant is a H3 inverse agonist. All are useful for narcolepsy. And then look at this question, doctor. If you answer this question, definitely a very good rank is waiting for you. Come on, come on, come on. A 25-year-old woman has a long history of depressive symptom accompanied by body ache and body pain that is secondary to car accident. Which of following drug might be useful for this patient? Options given are fluoxetine, sertraline, bupropion, duloxetine. For answering this question, you should know this patient having depression. So, lady with depression and having what? Body pain, secondary to car accident. That means you should know which is the antidepressant useful for treating depression as well as myalgia. That answer will be duloxetine. Duloxetine is SNRI useful for treatment of depression as well as for treatment of myalgia as well as for stress incontinence. That clinical knowledge, if you have in pharmacology, is very simple. I think all answering very nicely. Definitely you are going to get a very good rank. All the best. Come on, look here. And then you should know something about SNRI. Just now told, we have venlafaxine, duloxetine, milnacipram, levomilnacipram, vilazodone, ortioxetine. In that, duloxetine very important, useful for neuropathy pain, myalgia and stress incontinence also. And another very important question, NDRI, you must know, called bupropion. The bupropion not only useful for treat depression, also useful for treatment of control of smoking habits, having anti-smoking activity, and also useful for ADHD and obesity. Here one question. The bupropion may cause side effect of very important causes side effect of anxiety and seizure. It's the most anxiogenic antidepressant. That's why important. Next, SSRI therapeutic uses based question may be framed. So remember, SSRI drug of choice for OCD, post-traumatic stress disorder, and also for anxiety with the panic disorder. This is a very important area. And SSRI like dapaxetin approved for treatment of premature ejaculation. All this is important. Okay. Next, coming to antimicrobiology. Here, drugs useful for treatment of MRSA, VRSA. Look here. For MRSA, you know drug of choice will be vancomycin, Vanco. But today Vanco also developed resistant. So for VRSA, we have a lot of drug. Like for VRSA, we have linezolid, streptogramine, and then we have daptomycin, and then we have TG cycline. All these are given detailed class notes. You must revise. Okay. Next, look at this question. There is one second line drug for TB. That drug is contraindicated in HIV patient because of what? That cause thiazostone. It's a second line drug for TB. This drug is contraindicated in HIV patient because of risk of Steven Johnson. And look at this also. We have one drug called abacavir. This drug in a HLA B5701 allele in this patient may cause Steven Johnson syndrome. That means before prescribing abacavir, genetic screening test should be done. This is important. Similarly, look at this. We have one drug called carbamazepine that causes Steven Johnson syndrome in a patient with HLA B1502. That means which are all the drug needs genetic screening test mean think of abacavir and carbamazepine. Expect a question. Next, TB chapter, tuberculosis, you must revise, man. Anti-TB drug, you must know, you must know. In that repeatedly asked question, what are all the anti-TB drug? Unsafe in pregnancy, streptomycin. Streptomycin causes sensorineural deafness of baby, so unsafe. And then, regarding clinical parts, which are the anti-TB drug safer in hepatic failure patient? Remember, here safe drugs are streptomycin and ethambutol, whereas unsafe drugs are INH, rifamycin, pyrazinamide. They causes hepatotoxicity, unsafe in hepatic failure patient. And this again very important must know point. Anti-TB drug safe and avoid in kidney failure. In case of kidney failure, avoid using ethambutol, pyrazinamide and streptomycin. These drugs needs dosage adjustment in kidney failure, whereas the most safest anti-TB drug in kidney failure, think of rifamycin. Next option, isoniazid. Like that question, okay? Then, anti-TB drug causing psychosis. We are having isoniazid, cycloserine. All this you will be getting in your e-medicos video. So don't worry. Look at the concepts. Look at what is important. Note it in your notebook. The video, the slide uploaded in e-medicos. So don't worry about this. You just mark in your notebook and listen. Okay. And then anti-TB drug causing uveitis includes rifabutin. And then anti-TB drug causing hypothyroidism. You must know question. Very important. This is ethionamide and PAS. Okay. And then there are some HIV. Coming to HIV, anti-HIV drug causing lipodystrophy, very important. Like zerodin and stavudin cause lipodystrophy. Even protease inhibitors also causing lipodystrophy. Now, when this lipodystrophy, look here, lipodystrophy, how to treat this lipodystrophy? For treating this, we have a drug called tesamorelin. Tesamorelin, a growth hormone, releasing hormone, useful for treatment of lipodystrophy. Okay. And then anti-retroviral question. Anti-retroviral causing psychosis, important question for IFA friends. Anti-retroviral causes kidney stone is indinavir. Anti-retroviral causing intracranial hemorrhage, think of tipirnavir. So they give history, patient with the intracranial hemorrhage following anti-HIV drug. What drug? Like that they ask question. So read the question. And then remdesivir, you must know since COVID-19, so you should know remdesivir, a drug inhibiting DNA synthesis given intravenously causing risk of hepatotoxicity. All these are important point actor. Read the notes. Okay. And then antifungal, they give detailed history for aspergillosis. Very good choice will be oriconazole. Posaconazole, newer drug useful for mucormycosis. Another very important must know point, we have new drug called isavuconazole. Isavuconazole. This is useful for candidiasis, aspergillosis and mucormycosis. Okay. And usually for candidiasis we go for fluconazole. Aspergillosis we go for oriconazole. And for mucormycosis we go for posaconazole. For all these things we have a new drug called isavuconazole. Next, anti-cancer drugs. What must? In anti-cancer drug, common drug and their common side effect you should know. Okay. For example, they make a lengthy question like this. For studying the question itself, you have to waste 1 minute or 2 minutes. So like this. See, a 60-year-old woman complained to her physician. He's having back pain, works at night. History revealed that they have medical mastectomy, and the specimen shows HER2 positive, and then there's a scan revealed metastasis and high dense. All these things here. After studying the diagnosis, what is the treatment? It's a case of HER2 positive breast cancer. So we go for what? Answer trastuzumab. Trastuzumab, like that. So what they are asking, they will spend at least, they will waste 2 to 3 minutes for studying the question itself. Once you confirm the diagnosis, treatment simple. Look here. Trastuzumab. See doctor, in cancer, breast cancer, you must know very well. In male prostatic cancer, you should study very well. And lung cancer, very important. These 3 cancers are very important. So what are drugs useful for breast cancer, lung cancer, prostatic cancer, and also multiple myeloma? Important. One more thing, malignant melanoma. These are very important cancer. Repeatedly asked the question. So for breast cancer, that to HER2 positive cancer, we use trastuzumab, pertuzumab. Both are cardiotoxic drug. Okay. And then we have one more thing called trastuzumab emtansine. That's also a newer drug useful for HER2 positive cancer. Now, for HER1 and HER2 positive cancer, we have some tyrosine kinase inhibitors. Can you please write down, doctor? Name some tyrosine kinase enzyme blocker useful for HER1 and HER2 positive cancer. Come on, I'm waiting for answer. We have one thing called lapatinib, one more drug called niratinib. Lapatinib, niratinib, useful for breast cancer, tyrosine kinase enzyme blocker. And then some new drug you must know. For example, we have something called CDK4/6 enzyme blocker. CDK means cyclin dependent kinase enzyme blocker. Cyclin dependent kinase enzyme blocker like palbociclib, abemaciclib, and ribociclib. And then we have PARP, poly ADP ribose blocker, PARP blocker, like we have one thing called talazoparib. And then latest HER2-moxomab. That's a targeting against HER2 and CD3 useful for breast cancer. And one more point, doctor, we have one thing called everolimus. Everolimus actually immunosuppressant that is also useful for treatment of breast cancer. Very important. Next, look at this. Name some anti-cancer drug causing pulmonary fibrosis. For example, we have something called bleomycin, busulfan causing lung fibrosis. Okay. And then anti-cancer drug causing hand-foot syndrome are important. For example, we have a drug called capecitabine. Capecitabine, most important. Other than capecitabine, you should know 5-FU, doxorubicin, interleukin-2, pemetrexed causing hand-foot syndrome. And then this is very important. Look here. Look at the skin rashes, mucocutaneous skin rashes, that is flagellated skin pigmentation. Come on, doctor. This question I want to ask you. This is the problem due to anti-cancer drug. Can you please answer, doctor? Which is the anti-cancer drug causing side effect of flagellated pigmentations on the skin, like this lengthy rashes? Anybody? It is a typical side effect of what drug mean? Answer bleomycin. You must know. Okay. And then drug useful for multiple myeloma. Please revise important topic. Here we have one thing called bortezomib. You have proteasome inhibitor. Very important. And then penobinostat. It is a histone deacetylase enzyme inhibitor. Very important. And then sometimes simple question for your luck. If you have good luck, sometimes simple question can be asked. What is the antidote? They give some anti-cancer drug. Following the developed problem, how to manage anti-cancer drug toxicity and treatment. For example, cyclophosphamide causes hemorrhagic cystitis. Further, we can use one thing called mesna. Doxo causing myopathy. Further, we can use dexraxazone. It's an iron chelator. And then cisplatin causing nephrotoxicity. Further, antidote amifostine. And then anti-cancer drug causing bone marrow depression. Whereas neutropenia means treat the neutropenia by using colony stimulating factor. For anemia, use erythropoietin like epoetin. For thrombocytopenia is must know point. We have one thing called operlvicin. Operlvicin is a interleukin 11 analog. Very important. Okay. Next, regarding hormone, you must revise some clinical point. Drug useful for acromegaly. Drug useful for dwarfism. For example, acromegaly means pegosomin, growth hormone receptor blocker. And then this is important question. And then name one stomatostatin analog useful for treating Cushing syndrome. Important question. Peseriotide. Peseriotide is a growth hormone, that is stomatostatin analog useful for this peseriotide. And then diabetes chapter, very important. So all about GLP-1 analog, then DPP-4 blocker, then SGLT2 blocker, like that. Never anti-diabetic you should study, man. SGLT2 blockers are very important. For example, we have something called gliflozin, serligliflozin, dapagliflozin, canagliflozin. All very important. They causes glycosuria. We have one thing called satagliflozin. This drug inhibiting SGLT1 and 2, satagliflozin. All are causing glycosuria. So most common problem of this drug is they cause UTI, urinary tract infection. That is important. So SGLT2 blocker must know topic. Not only this, man, even GLP-1 analog, DP4 blocker, all anti-diabetic drug you must know. And then drug useful for treating obesity also you should study. This is again important topic. For severe obesity, we give combination of bupropion, NDRI, plus naltrexone. Naltrexone is opioid antagonist. Or else we can use bupropion plus zonisamide. Zonisamide anti-epileptic agent. Or we can use phentermine. It's a sympathetic stimulant given with the topiramate. Topiramate anti-epileptic agent. That means you know anti-epileptic drug useful for treating obesity mean think of zonisamide and then topiramate. Okay. In that I want to ask one super question. Anybody? Name one anti-diabetic drug approved for treatment of obesity. Come on. I'm looking at chat box. Can you please answer? Name one anti-diabetic drug approved for treatment of obesity. The answer will be liraglutide. We have one thing called GLP-1 analog called liraglutide. It is FDA approved anti-diabetic drug for treatment of obesity. And then anti-diabetic drug causing weight gain, weight loss, weight neutral. That's also important question. Please read. Okay. And then cholesterol chapter also important. Nowadays most of people having cholesterol, high cholesterol. So cholesterol chapter, especially statin, fibrates, niacin. Please revise. The commonly used drugs. Statin, niacin, fibrates. Revise. And here we have one thing called PCSK9 blocker. That's must know topic. PCSK9 blocker, like we having alirocumab, evolocumab, monoclonal antibody useful for lowering lipid. That too lowering LDL cholesterol. Mean think of alirocumab and evolocumab, lipid lowering monoclonal antibody. And next chapter, bone chapter. That too drugs useful for treating osteoporosis. You must know definitely. There are some drugs promoting osteoblast, some drug inhibiting osteoclast. Some drugs are promoting osteoblast, some drugs are inhibiting osteoclastic action. For example, look here. Bisphosphonate, the so-called zoledronate, the drug of choice. Bisphosphonate, the so-called zoledronate. That's a drug of choice for treatment of post-menopausal osteoporosis. Okay? And then denosumab, a rank L antagonist. Raloxifene, SCRM. All these are inhibiting osteoclast. Whereas we have something called teriparatide, abaloparatide. These two drugs are parathermone analog, PTH, parathermone analog. And then we have vitamin D, calcium. These are all promoting osteoblastic action. And then we have one thing called strontium ranulates. This drug having dual action, that is promoting osteoblast as well as inhibiting osteoclast, called strontium ranulate dual action. And then latest point, you must know question. This is expected question. Look here. We have romosozumab, blazozumab, anti-sclerotic antibody going to promote osteoblastic action, useful for treating osteoporosis. And then please revise selective estrogen receptor modulator topic, and also revise selective progesterone receptor modulator, not only for pharmacology, even for gynecology aspect, very important. We have one called clomiphene, useful for treatment of useful for promoting ovulation. And we have one more drug, very important drug called aspimifen. Aspimifen is a SCRM, useful for treatment of dyspareunia, for treating painful goitis. Okay, and then drug useful for Cushing syndrome also, you just revise. They may give big history. Patient having moon face, buffalo gum, obesity, diabetes, hypertension. Following this diagnosis, treatment. So for Cushing syndrome, we have something called glucocorticoid antagonist. Glucocorticoid antagonist like metyrapone, ketoconazole, mitotane, aminoglutathione, trilostane, pesidiotide, intermediate. All these drugs are used for Cushing syndrome, where these two drugs are called chemical aldehyde agent. And then we have one drug called mifepristone, very important. It's a glucocorticoid receptor blocker, useful for treating Cushing syndrome. And then coming to GIT, important MCQ, you must know question. Proton pump blocker, please study, man. Proton pump blocker, you must know detailing. That too, proton pump blocker having usually half-life, short half-life, but longer action. That because of irreversibly inhibiting proton pump. That point you must know. And some newer drug name, please answer. Tenetoprasol, ilaprazole. Here, tenetoprasol having longer half-life. That point you should know. And then some more another newer drugs are vonoprazan and then rivaroxaban. They also newer proton pump blocker. So proton pump blocker topic, please revise, very important. Similarly, one more topic you should know, drug useful for IBS, irritable bowel syndrome. This is very important GI topic. Abdomen topic, very important. We have something called lubiprostone, a chloration activator, useful for treatment of constipation. And then we want to think called linaclotide, a CFTR, cystic fibrosis transmembrane regulator activator, useful for treatment of constipation. So drug useful for treating constipation and drug for diarrhea. So please read IBS is a must know topic. Next, miscellaneous autocoids. Here, drug useful for gouty arthritis, drug useful for rheumatoid. Please read, must know. In acute gout, we use NSAID like indomethacin, or we can use colchicine, or we can use steroids. For chronic cases, we are using allopurinol or febuxostat. Both are xanthine oxidase inhibitor. Other drug name, we have one thing called lesinurad. Is important expected. It's a uric agent. Newer drug, uric. And then for aggressive control of hyperuricemia, we have something called rasburicase, pegloticase. Both are going to promote the metabolism of uric acid. They call uric acid metabolism enhancers. And last question, can you please answer? Name one IL-1 blocker. Name some IL-1 blocker useful for treatment of gout pain. Come on. We have something called canakinumab, and then rilonacept, and then anakinra, and then rheumatoid. For rheumatoid arthritis, please read TNF alpha blocker, IL-1 antagonist, and then leflunomide, very important, and then tofacitinib important, and newer drug upadacitinib baricitinib important. Okay, and finally ALS. For ALS important must know topic. We have to remember edaravone, riluzole. Edaravone very important revision. You must know it's antioxidant. Riluzole, a drug NMDA blocker, and then drug useful for asthma. That too newer MEB names: omalizumab, dupilumab, IL-5 blocker, IL-13 blocker name, and finally very important anti-glaucoma drug. You must know in ophthalmology drug useful for glaucoma. And once again AIMS question, for vitreous macular degeneration we use one drug called acryplasmin, and then drug useful for glaucoma and the adverse effect. For example, lid lag caused by apagrandim, uveitis caused by brimonidine, and then bronchospasm by beta blocker like timolol, and then nasolacrimal duct obstruction by beta blocker, cataracts by ecothiophyte, and then iris pigmentation by latanoprost, metoprost, and then hypertrichosis eyelash by metoprost, and then cystoid macular edema, prosteroid analogs, and congenital hemorrhage by dipivefrin. Latest point, please note this one: nitarsudil ripasul rho kinase enzyme blocker useful for glaucoma. So doctor, given time I may exceed a little bit extra point. My given time is only 48 minutes. I can take an extra time. Sorry for the extra time I taken. Very extremely sorry, but I finished all my thing starting from GP, ANS, autocoids, CVS, renal, blood, and then we go over CNS, and then antimicrobial, and then cancer chemo, and then immunology, and miscellaneous ophthalmology. All the topic I covered, man. All the must to know drug I told now itself. So your duty, please read this repeatedly, revise, develop confidence, and see the videos repeatedly. All the DBT video you please utilize properly. All the AIMS capsule utilize properly, and TNT notes video utilize properly. If you utilize the damn material, definitely you're going to win the match. So God is waiting for you to give very good rank. So all the very best, man. So read well. All the very best. Thank you. May God bless you. Okay. Thank you. All the very best.